Excuse me. Good morning. I am calling to order what is a special meeting of the Committee of the Whole. Just by that, I mean that it is at a different time than we often have. My name is Elizabeth Glidden. I am the chair of this committee. I'm joined today by my colleagues, Councilmember Reich, Yang, Quincy, Warsami, and Goodman, and I do believe others will join us shortly. We have one discussion item today. It is a presentation of the municipal minimum wage staff report. And I believe Ms. Rivera Vandermeide is our lead presenter here, but has many others with her who have supported the work leading to this staff report. We have a substantial presentation, so just as a note to my colleagues, I'm going to ask that we allow, excuse me, Ms. Rivera Vandermeide to do her full presentation, and then we will have substantial time for questions as we're able. And we've also been joined now by Council Members Cano and Bender. So without anything further, Ms. Rivera Vandermeide.
Thank you very much. Chair Glidden, council members, my name is Nuri Rivera Vandermeide. I'm the Deputy City Coordinator for the City of Minneapolis, but really come to you as a representative today of a group of staff that came together from multiple departments to talk about the topic of minimum wage. In October 5th, I believe, of this year, you asked us to come forward and directed us to create an engagement plan. And we did so in October about how we were going to engage community, how we were going to go about looking at other jurisdictions who had done an increase in minimum wage policies throughout the nation, and come back with recommendations on a minimum wage policy, and that is why we're here today. So I'll start with what we heard. We did go out and engage. We did a variety of listening sessions. We did 16 in total. We reached over 500 some individuals. We also released a survey in multiple language and got over 1,700 responses, which we thought was extraordinary in terms of engagement and the passion that people, both workers and businesses alike, have around the issue. We also received over 100 written comments and letters, either directly through the minimum wage email or through your offices that came to us as well, that we included as part of the public record. What we heard, as is no surprise to many, is a wide range of opinions, and we want to try to honor some of those opinions here. We heard on one side of the equation that really this is city overreach, that when you think about a municipal wage policy, that it goes beyond what cities and municipalities should do, that it really should be a statewide solution, and that government should not be in the business of telling businesses how to run their businesses. On the other side of the equation, we heard from voices who say that affordability is one of the top concerns about living in Minneapolis. They cannot afford housing, they cannot afford transportation. Transit and childcare and healthcare are just too difficult in the current wage scenario. There have also been arguments that where cities have acted, states have followed. And while many people, and I would say most, including those in our work group, agree that a statewide solution is preferable, we also think that there are opportunities that we have seen by which cities have acted, and that has moved counties and eventually moved states as well. The majority of voices really fell somewhere in between, right? This is not an issue that is black or white primarily. It is very nuanced. We heard a lot from our community members and our business community in particular that not so much that they were unsupportive of a increase in wages, and we'll talk a little bit about the fact that 15 kind of became the number that people most often mentioned, but that businesses per se weren't unsupportive of the fact that everyone should be able to make a living wage or make enough of a living wage to feed their families. In particular, we heard a lot from the restaurant industry, and through this presentation, you'll hear us bring that perspective forward because we thought it was a very vocal and poignant voice as we turned our attention to how do we recommend a policy. But we heard a lot from the restaurant industry in particular that they too get the inequities between front of the house and back of the house and are trying to find a way to solve that gap without at the same time causing detriment to their own business. In that survey that I mentioned beforehand, I give you a little bit, and I know this is a long presentation, and so I'll try not to go through the minutia of every slide as we move forward, but we wanted to let you know who we heard from in the survey demographics. As we think about the types of industries and the types of workers that responded to the survey, we give a breakdown, but we note at a high level, 77% identified themselves as employees or employee advocates, and only 14% represented themselves as employers or businesses. 9% represented themselves as others, and a lot of those folks were kind of in the educational arena. Some highlights about what we heard from the survey are a variety of things. We have 50% of those who responded said that we should have no exemptions based on business types. Although when we talked a little bit, there were comments, there were open-ended questions in the comment section. Some people commented that if you're going to make a break on large to small businesses, that what Minnesota statute, and we'll go a little bit in this a little bit further down, that how the state legislature does it in terms of revenue may not be the right approach for them as they thought about that small or business breakdown. 47% favored a statewide approach. Only 8% favored a Minneapolis-only policy. And to be fair, we did not give people an option in the survey to say, well, barring a statewide approach, how would you feel about a city municipal policy? And 21 stated they were just simply not in favor of a municipal minimum wage policy at all. Of the 409 respondents that answered this particular question, 73% felt that the policy should be phased with a period of over at least 2 years or more. There was some feedback, which was, and again, we'll talk a lot more about tipped workers as we continue to move forward. There was a lot of feedback, but it was pretty mixed and reflective from what we heard in our conversations and from what we've seen in other jurisdictions about whether to include tipped wages or not as part of a minimum wage. 63% were strongly in favor or somewhat in favor of an increase to the current minimum wage, although that again was not necessarily tied to a particular number. And we note that as those responding to how an increase in minimum wage would impact their business, 48% they would have to decrease their workforce, 29% it would not impact their workforce at all, 18% were unsure, and 5% said that it would result in an increase in their workforce. We also were fortunate enough to receive some business surveys from third-party or independent business associations. The Southwest Business Council, the Lake Street Council, and the Minnesota Restaurant Association were kind enough to give us their summary responses, and they did their own projections. As we look at those and we offer those because they are part of the record, we want to make sure that we honor the voices that they heard as well. We see mostly across the board, for the first two, Southwest Business Council and Lake Street Council, tremendous concern and a perception of negativity if this were to move forward, a municipal wage increase were to move forward. We note the 61% from the Southwest Business Council said a raise would be very negative to their businesses. We note too in the Lake Street Council, of the 13 respondents, 92% stated that a minimum wage increase would cause them to decrease their workforce. The Minnesota Restaurant Association also did a survey. We did not get the length of the survey, but did get kind of a 1-page or 2-page summary of what that looked like. And in that summary, what they were really looking at is what is the average that either someone as a cook, a support staff, or a tipped worker makes in Minneapolis, as the issue of how much folks make in tipped wages became kind of very central to our debate as we move forward. And so we offer that as well for your information. Bottom line, for our listening sessions, we found very major themes. I think by and large, we saw residents want a city that they can have a quality life that lets them care for their families, to be healthy, to live in safe housing, and to pursue whatever they define as personal growth. We want a thriving business community. We are known to be a vibrant and busy business community here in Minneapolis, and there was overwhelming consent that we want that to continue. There was overwhelming agreement that national or state policymaking would be a better approach, but also heard very strongly that, as seen in other jurisdictions, this is an area where cities can lead the way and impact larger federal, not federal, but larger county or state policymaking as that moves forward. We also want to honor the fact that businesses overwhelmingly voiced concern, and that doesn't mean that businesses are against a minimum wage. I want to make sure that we don't pit this as an issue of businesses against workers. That is not certainly how we took it, but that businesses are concerned about this and any other regulation that impacts their business and what that means for cost, and concerned about potential unintended consequences as regulations like these move forward. There was a great quote from somebody in our workplace advisory group that really spoke to the fact that businesses should not be the folks who bear the burden of all this regulation in terms of increased cost. And she mentioned the notion of communal issues require a communal response, and that resonated with our work group as we sought that forward. So it's a thread that we maintained while we did our work. We shifted gears a little bit, having done some of that engagement, and we started looking at what is out there, what is the research. And so we started with a variety of summaries and studies on the topic, and we really discovered that studies are all over the map, and I'll talk about that in a minute. From our Wilkins study, and I know that the folks that had done that, the consultant that had been hired by the city and commissioned by the city to come give a report, at a very high level, we'll remind folks that what we learned from that study was based on that data. There are about 47,000 workers who will be impacted by an increase, impact in the positive, to an increase to $12 per hour. About 71,000 would be affected by an increase to $15 per hour. And if you break that down in demographics, what that really means is that those increases are going to most impact low-wage workers, and in particular, low-wage workers of color. And so that is something that as we looked about, we kind of kept that in the back of our mind as well. As we think about some of the other studies that we saw in the Wilkins study, and I should have mentioned that behind me stands a group of individuals who worked on this. So as you pose questions, if there are any individual questions about the study and so forth, there is staff here who can perhaps answer them in more detail than I can. We look at a simulated results of what the Wilkins study said, and certainly there were gaps that left us at the end of that study wanting to know more. But from the initial outlay, it shows us there are certain industries that would be impacted by a minimum wage more than others. Retail, restaurants, and health in particular, or non-hospital health, I should clarify, in particular were the ones that would be most impacted by a wage. And as they did a simulated model out to the time at which 15 or 12 would be implemented, and I think the date that they chose was 2021 at the time, what their simulated model results that at a high end of total employment losses, that the restaurant industry would perhaps bear the biggest brunt of that at minus 3.35%. I was reminded by staff that at the height of our recession, just to put it in time and place, we lost more than 4.5% of our employment. So that puts a little context on what that would look like. At the upper end in total employee earnings, that the same restaurant industry showed both the lower and the upper ends of that with a up to 28% increase there. We also see health with about a 14% increase as that moves forward. We also looked at other jurisdictions, and I know for one, I have sent you multiple emails about a big spreadsheet that we have come to kind of live by as we move forward. And one of the things, while not binding, we found that a look at other jurisdictions is useful to really kind of putting ourselves in context for what's happening on the national platform. At a high level, and this matrix was also part of the appendices, so it is a public document and posted. But at a high level, we found that of the 51 jurisdictions we saw, they had a range of their maximums, with most of them trending towards 15 at the moment. There are 12 that went between $10 and $12, and 11 jurisdictions that went from 12 and just under $15 as that moved forward. Flagstaff was the only anomaly to the 15. They had gone to $15.50. We saw most of the jurisdictions were indexed to inflation upon arriving at their target or universal wage rate. And so we noted that only 4, and 2 of those were county jurisdictions, had not indexed those to inflation. Phase-in periods, and again, we'll talk a little bit more about some of this as we get to our recommendations, but phase-in periods varied Most of the jurisdictions fell between a 3 to 5 year period, but where there were extended phase-in periods, which is something you're going to hear us recommend and talk a little bit about, they went from 6 to 8 years beyond, or as a total. So it was 1 or 2 extra years beyond what their original target date was. The issue of tips, and again, we'll talk about this in more detail, was as divided as perhaps some of the conversations we had in community, frankly, some of the conversations we had in our work group. Whether or not to include tips as part of wages, we saw 24 jurisdictions said yes, 27 said no. So it's pretty divided and pretty evenly divided at that about what that looks like. We looked at carve-out for business size, and again, the majority of jurisdictions did not do a special carve-out for business size. 13 of them did, although 9 of those were really extended implementation periods, so not true carve-outs where they truly exempted people. There were only 4 jurisdictions that did that. And finally, we looked at carve-out for youth as well, and this was also similar to tips. This was another pretty divided one, where we had 26% included a carve-out for youth, although 10 of those had an extended time period, and there'll be more detail on that. 25 of them did not. We have a little reminder there, not that anyone on this dais needs a reminder, but we want to try to put the context of minimum wage in place, and so we've included kind of a memory of the current minimum wage, both at the federal level and at the Minnesota state level. The other thing we learned is we looked at other jurisdictions, and I won't go through every one of these, but we wanted to say part of the difficulty that we had, and you'll hear this again in the studies, is that most jurisdictions had not really implemented them. As we looked at the dates of implementation on when they start, it really has been 16 started just last year, 14 have started this year. So the big majority of jurisdictions are just embarking on this journey, which means that we don't really know the impact of what's going to happen in cities that have approved this type of minimum wage increase, and we won't know that for some time. There are some jurisdictions that started a little earlier in the game, and there haven't been a lot of studies that really report back to them, and that'll speak to one of the recommendations we make as well. We turned our attention to our economy because we wanted to make sure that we had, as we looked at this work, that we not only looked at what the plight of current workforce was, but we also looked at our regional economy a bit. And so we've got some breakdowns of what that looked like. 28% of all people of color are working in the healthcare industry. This pie chart kind of has a distribution by Minneapolis jobs, and you can see where the largest, and we've tried to put those out, where the largest chunks of folks are employed at. 11% of people are working in education, of people of color are working in education. 9% of all people of color working in Minneapolis are in food service or accommodation. And 7% of all people of color working in Minneapolis are in the administrative support, which falls within that professional and business services. Those are some of the crossover areas that we saw in the Wilkins report that would be most impacted by an increase in minimum wage. We wanted to take a deeper dive as we looked at some of those industries, because certainly we heard a lot in our listening sessions about, and again, the restaurant industry comes first and foremost as we think about what that looks like. And in particular, we heard about what average wage is and what the average wage for waiters and servers are in the industry. So we really wanted to break down for you, and I don't need to go through each detail, but we wanted to break down for you by number of employees as you're thinking and moving forward to perhaps considering a break between large and small, to take this into account in terms of what the average wage is of workers. And we'll talk a little bit about how difficult it is to find the average wage for our food industry workers in a little bit when we get to that recommendation. But as you can see, this goes across the board on by number of employees, what does that look like? How many employers, how many employees, and what the average wage is. We did the same for non-hospital healthcare. We certainly heard in our listening sessions some concerns, particularly about nursing care facilities and assisted living for the elderly. That certainly came up. What we heard was a bit divided. We heard some folks, and I think our research bears this out, say that we actually need to provide our caregivers with an increase. A lot of the caregivers in that space would fall underneath a minimum wage, and What we saw were some averages around $10, and so that would still fall underneath what the city is considering. But at the same time, we heard that some concerns about I get reimbursed by Medicare and I don't have a place to spend those costs and to put those costs on. We did not decide ultimately to, if you read the report, to recommend an exemption for non-hospital health care. We did not see it in other jurisdictions. We believe what we have heard in the research is that many of our care facilities are already upping their minimum wage and trying to recruit a higher talent pool. But it is, again, an area that we note and that we'll be wanting to look at in annual reviews of how we are impacting the economy moving forward. We also looked at nonprofits, which was another group, again, a small minority of groups that came up in terms of needing or wanting an exemption. And at the end of the day, as we were talking to some members about where do nonprofits land, as we looked at the numbers and as we talked a little bit more to their community or to businesses in the nonprofit world, most of them acknowledge that they are well beyond the kind of minimum wage that we're talking about, in part because they have already needed to either recruit or retain employees at higher rates than what the minimum wage is. But we wanted to sort of share that with you as well. For any of the industries, I'm sure we can do a deeper dive, so if you wanted additional information, I'm sure staff can take a look at that. We wanted to put wages in terms of context as well, and I know that a lot of this is dense and very technical, but as we looked at sort of the economy and what it looked like in dollars and cents, we looked at the poverty thresholds, and in this one I've got thresholds for 2017. For one person, the poverty threshold is $12,060. So if we looked at, from the Wilkins study, one person making $7.80 an hour, they would earn $16,224, which is about 8% of our workers in Minneapolis make that threshold. An additional 31,000 earning less than $15 an hour would really continue to fall within that threshold above the federal poverty threshold, but certainly not meeting what we look at next with the living wage in Hennepin County. And I'll make a little plug that as we close out, I think staff was finishing up the finishing touches on this, but we are about to release and launch a Tableau, an interactive format that you can look at the deed data. You can look at a whole slew of data that our CPED folks in particular really gathered and amassed, and be able to play by jurisdiction and by wage level what that looks like. It will be a public-facing portal, and so we welcome folks to take a look at that. But when we look at the living wage calculator for deed, we look at what that looks like in terms of a single person. That would equate to a $15.25 an hour wage. A single person with one adult would bring that up to $29.87. And a family of two adults, and that's the median, and one child, that's the median family size in Hennepin County, at least, was deemed at 3. That living wage number is $19.80. So again, we have now looked at, we've heard from community, we have looked at some of our data. We turn to some topical studies to try to get some insight into what has happened in other communities. And I am frustrated to share with you that it's widely varied and frankly inconclusive. I wish I had something better to say on that end, but the reality is that most jurisdictions, 82% of the jurisdictions, had only implemented a change in wage in the last 2 years. That means there just hasn't been time enough to study the impacts of what a minimum wage policy is really going to do to them. The other reality is that economies are impacted by all sorts of different factors. There is no single one factor that impacts how an economy is going to do. Minimum wage is one, but as we saw in the Seattle study, there were notes in that study that said we saw increase in wages and increase in employment, but frankly, we could have seen that just because it was a robust economy. We do not know that it is causally related to the minimum wage. Mentioning that study, I think I've got it noted there. we also looked at a study, a 2011 study, that really looked at San Francisco, who at the time had just gone to $8.50 an hour, Santa Fe and DC. The end results, again, there, they were looking at fast food and food services, retail, and low-wage establishments, showed generally that minimum wages can raise the earnings of low-wage workers with little discernible impact on employment. DC was too small a study to yield anything substantive, and so they mentioned that in their results. We saw NELP, the National Employment Law Project, had done several studies on cities, but frankly, they were done at the time or before the time of an implementation. And so their results are widely on modeling what an impact could be, not on what the actual impact is. So for example, San Jose and Santa Clara, California and Fresno City, and the New York City study, all of them which were done by NELP, said, and we're very honest about saying this is before we really know what full implementation means. And so they're just not as helpful as one would like. They're great to think about what modeling could be and might be indicative or illustrative per se, but they're not definitive studies. We also looked at a growing amount of research that linked minimum wage or minimum wage to health impacts, and really it's the issue of what is the link between health and income in general, health and poverty. There are two recent studies that our Commissioner of Health, who was part of our work group, pointed us to. One that really looked at the mortality, the premature mortality rates of New York City residents post a $15 increase, and concluded that results were positive enough to say that there are links between premature mortality and low life expectancy and poverty, just as other studies have commented. There was a just recent study that came out in April of this year that talked about minimum wage, that increasing minimum wage by just a single dollar could reduce adolescent birth rates amongst 15 and 19-year-olds by 2%, and possibly reducing about 5,000 births to teen parents across the United States. Our Minneapolis Department of Health actually did an income and health brief on this in December of last year. It's also included in the appendices to the report. And really, there should be no surprise that they speak a lot about the predictors of health status are the factors that are known of social determinants of health, and that includes income as part of those social determinants of health. In speaking about poverty and poverty concentrated amongst people of color, children, people of lower educational attainment, and female-headed households, policies that affect household income really result in a substantial benefit to city residents. At the end of the day, their conclusion was better economic conditions for Minneapolis families mean longer and healthier lives and ultimately more stable communities. So in summary, we saw that an increase in minimum wage will likely impact many of our low-wage workers, particularly our low-wage workers of color. That we see that our peer cities and topical studies are illustrative, but perhaps not conclusive. We offer them as benchmarks. We offer them as hopefully learning lessons as we move forward. But obviously, we would have to think whatever policy looks like for Minneapolis. We note that businesses, particularly restaurants, have expressed great concern about moving forward with a municipal minimum wage policy and have really urged us to think about particular considerations that would make implementation easier. And then finally, we steal a quote from one of our work group members who I think really put it best. It says, while understanding that adopting a municipal wage policy will result in spreading additional costs to employers and customers, the continuing gap between the current state minimum wage and the actual cost of living and raising a family in the city is a significant ongoing economic stressor to local workers and to our community that has a real social and public cost. So we come now to our recommendations. We talked a little bit about scope, and we sort of broke this down into employees and employers. For employees, we thought we would model, and you'll hear this woven into some of our other recommendations, that we would model what the state does. We heard constantly that administrative simplicity is preferred in our application and our recommendation, particularly for business as we move forward. So we recommend that employee be anyone who works in Minneapolis for any amount of time consistent with state law. We saw 27 jurisdictions had a strange kind of 2-hour per week requirement in order to apply. But we note that in talking to our friends at Dolly, that they mentioned at the state level, that they mentioned that they don't have that kind of consideration, that an hour's worked is an hour of work, and that's what minimum wage is based on. Who is defined by employer is a stickier issue, and I'll say that we defer to our city attorney's office for definitions on what that looks like. Our initial recommendation is to base it on any business, regardless of business location. And we saw that, again, we certainly had that conversation in the paid sick and safe time. We saw that in many jurisdictions moving forward and that have successfully implemented policies throughout other jurisdictions. We note that there has been some clarifying languages, and we point to Oregon in that matrix that had some clarifying language that said, that talked about when an employee performs over 50% of their work in a pay period at the employer's permanent fixed address, the pay rate is based on that location. In the case of employees who make deliveries and so forth, their pay is based there. So we offer that simply as guidance and say that we're happy to work with the city attorney's office as they determine what an employer looks like. We also note that another approach that you could take in terms of employer is to follow what the State Department already defines as employer. There is a whole slew of exemptions that includes, or excludes, I should say, folks like bona fide executive and administrative professional staff, casual babysitters, seafarers of all things, a lot of agro workers, folks that are nuns, monks, and volunteers that are part of religious organizations. There are a variety, independent contractor, taxi cab drivers. There's a variety of exemptions in the state code, and that's another approach to take if you want it to be consistent with the state. We talked a lot about what is the number became not the largest trigger point for our conversations, but certainly one that we talked a lot about. And I want to put this in context in terms of our recommendation. We certainly heard 15 talked about a lot, and we credit a lot the advocates, primarily starting with 15 Now, which is a national movement that came to Minneapolis and spoke a lot about the numerical value of 15. Pathways to 15 subsequently took that number too and owned it in a different way. But every time we went to a listening session and we tried to correct people that we didn't know what a number would land on, 15 came up over and over again. So while we don't like to necessarily say it's the de facto standard, it certainly became the number that most people spoke about. We also note that it follows the trend. National trends all across the nation are going towards a 15, but we wanted to take a deeper dive and really look at what does that mean. In that tool that I mentioned that is about to be launched soon, we give you a set of 15 and what that looks like. 15 in San Francisco looks like what in Minneapolis. 15 in Oregon looks like what in Minneapolis. And so we invite you to take a look at what that is. We also we looked at several other mechanisms for determining a number. One of those was looking at our peer city index. Greater MSP has a series of peer cities that they routinely look at when comparing Minneapolis to other jurisdictions for a whole variety of other actions. And when we looked at our peer city across the board, we saw that the average of those peer cities was $12.49, which really aligns well with our closest Midwest neighbor, Chicago, which opted not to go to 15, but rather to $13 as their minimum wage. We looked at looking at the median of what that looks like. And so as we think about a median metropolitan wage, we took the current median wage level of $20.76 and calculated it out with an inflator. We then took 55%, and how we arrived at 55% is that there are studies that say that once you start getting beyond 55 or 60% of a median wage, then you may see more impacts on the business community than not. So we opted to look at what 55 means for the median, and that number yields a $12.85. We also, in the vein of looking at different ways to look at this and knowing that there is no right number necessarily, we thought of looking at living wage, and we thought of the living wage for a typical size household, and that in Minnesota is 3 people, 2 adults and 1 child, is $19.80. And if we looked at a way to think about how do we put some of the burden on businesses, obviously, who are employing and are in charge of paying wages, but not all of it. And we just used a percentage and said 75% goes to businesses, 25% does not, acknowledging that none of the minimum wages we saw in any jurisdiction attempted to achieve living wage status. We saw that very clearly and very deliberately mentioned in the Chicago report. That as we looked at that 75-25% split, we get a current living wage or a minimum wage number of $14.85. That 75-25 you could think about as 70-30, it could be 80-20, but we wanted to offer up that there are different approaches to arrive at a number. Ultimately, our recommendation is that we use our peer region index or a range between our peer region index up to and no more than what the national trends have asserted. That is a policy decision for you to make, but we offer up a range between $12.49 and $15. For any wage level selected, we also recommend that there is a phase-in approach and that really speaks to how do we ease the administrative burdens, the economic burdens on businesses as they get here. And so as we looked at our next topic, which is how do we do a tiered phase-in, we looked across our jurisdictions, and as I mentioned before, they're kind of all over the place, but the common denominator was that where there was a break for particular industries, most of them were for small business. There were a couple exceptions that instead of small business, they used youth. One used nonprofit, and I believe 4 of them used tipped versus non-tipped as a break as well. That we go at a tiered phase-in for no less than 4 years, which is where the majority of jurisdictions landed, with a longer phase-in period for smaller businesses. We had 10 jurisdictions that extended implementation timelines up to 6 to 8 years for specific groups or industries. And again, those were primarily for tipped versus non-tipped, small businesses versus large, nonprofits, and youth workers. There were several jurisdictions of the 15 that did this multi-phase approach. We had 3 of them that did a 3-tiered phase system. So we saw New York, Seattle, and Oregon that allowed for 3 different stages of phasing. We saw 7 in California that included just that 2 phase-in for smaller businesses and 6 that allowed one for non-tipped youth and nonprofits. We note again that in our survey, 73% of respondents preferred a phase-in of at least 2 years. So our recommendation coincides with that. This is the hardest, I would say, issue that we dealt with. And I'm going to be very candid and honest to say that we as a staff team struggled with this question. I believe we only came to a determination on where we're going to land just within the last week or two as we move forward, because there is no right answer to whether or not you include tipped wages or, thank you, or not into a calculation of minimum wage. We note too, again, that 27 or 53% of the jurisdictions that we saw had decided to opt to not to include tips as part of their wages. And while a slight majority, it is still pretty evenly split. So it was our hardest issue. One of the reasons that it was so difficult is that there's no consensus on the issue. We appreciate the Minnesota Restaurant Association survey that gave us some insight into what they did. They looked at 83 locations. Some of them had the same owner, so I won't speak about owners, but 83 locations around the city based on a snapshot of last October. And they yielded average earnings of $28.56 an hour for their servers. The problem we found with that is that with over 830 restaurants, cafes, and bars in the area, that really represents only 10% of the businesses. And because we didn't know the survey methodology, we don't know if that took into account all the gamma of the different levels, the different types of high-end to low-end restaurants and restaurants in the city. We saw the Bureau of Labor Statistics that looked at data spanning over 3 years, so as opposed to a one month snapshot. We looked at the BLS, and they looked at 3 years from November 2012 to May of 2015. The results there show a state median wage of $8.98 and an average wage for servers of $10.29. But again, there we found some issues because that number, that average, really takes into account all the restaurants in the Minneapolis, St. Paul, and Bloomington area, not just those in Minneapolis. And so there's a difference there in terms of what the potential rate could be. There were calculations done from the Restaurant Opportunity Center based on that BLS statistic that looked at the 2015 U.S. Census Bureau data for food preparation and serving related occupations. They estimated a $12 an hour for Minneapolis as a medium. So one of the difficulties in coming to how we came to this issue was the fact that we couldn't really pinpoint what average looks like for Minneapolis in the restaurant industry. And we want to really acknowledge here that our restaurant industry is vibrant. They were very vocal and very generous, those that commented and shared their information and their data with us about what this would look like and what their costs were. The problem we had is in the aggregate, they are perhaps, again, illustrative, but not representative of the entire world of cafes and bars and restaurants throughout the city, because we just simply have all sorts of different wage levels and tip levels, quite frankly. The other consideration that we found as a difficulty in trying to think about wages is that wages really vary. That was an October snapshot for the Restaurant Association, but really they vary, whether it's a summer when a patio is open or winter when perhaps things are a little slower. They vary from shift to shift, so a lunch hour shift may look very differently than somebody who's working a dinner hour in the middle of summer. There's also a consideration, and certainly we heard this from some of our worker employees or worker staff as well, that not all tips are recorded, that even though credit card tips are generally reported as wages and the world is moving more towards credit cards as we move that forward, that sometimes they can be cashed out and distributed to servers at the end of their shifts and they may not end up on wage files. And so it's just hard to really get that to make sure that all the data that we have is accurate. Ultimately, we took again another look at studies, and there was one study that stood out in our mind, which was a study that had been commissioned in 2014 by the Obama White House. The National Council of Economic Advisors really looked at the issue of tipped employees, and in particular made a compelling case about abolishing the multi-tiered tipped system in the nation, in part arguing that it would do benefit to women workers across the nation, but really talking a lot about how difficult it was to enforce, how uneven enforcement was, and how an issue about wage theft was there. I say these words not to in any shape or form allege or allude in any way that we are concerned about our current Minneapolis restaurant industry engaging in wage theft. Again, we heard great voices and want to honor the voices that we heard from the restaurant industry. But it is not the same for all employees. And an employee who is working for someone who is calculating their tips and they have a disagreement with, they would have to then go, the onus would fall to them to make sure that they're getting the wages that they deserve. They would have to file a complaint with the employer. They might have to go to civil rights, which we'll talk about in a minute, and file a complaint to get that wage back calculated into their, as part of their property. That onus particularly really kind of compelled us to start looking at this issue in a very different way. And ultimately, we sort of fell down on the fact that in 1984, which I know was some years ago, but not too much in the recent past, the state itself decided to not be a two-tiered wage system. The state in 1984 decided that it wanted to be a state that really stood for one wage. And so it would seem to us that we should honor that approach, and that we, again, we could lean in either way, but we just decided that at the end of the day, that was the best approach to move forward. We note, I had mentioned to staff that I had found some legislative history, and I found a report from 1984 where the then accounting director for the Department of Labor and Industry said in 1984 that he was for the bill, saying that tip credit causes confusion for employers and employees, is difficult to enforce, and expensive for the state to administer. Here we are in 2017, kind of along the same lines about the unevenness of enforcement. Our next recommendation deals with youth workers. Again, this was pretty split around jurisdictions, pretty 50-50. We note that the Minneapolis youth labor force is any resident 16 or 19 years old working or looking for work. It's about 22,000 youth workers. The estimated unemployment rate for this demographic is a bit higher at 27%. And businesses, as we looked at and we heard in our listening sessions, businesses brought up a training wage as something that they were very interested in, noting that for youth workers in particular, especially those seasonal workers in the summertime, that there is a time and an expense just to get people trained on the job. For us, as we looked at it, we also looked at the state, and the state guideline similarly has a training wage for anyone under 20 years old for their first 90 days of employment. We opted to recommend that, to follow those guidelines, in part because we concur that there should be some learning curve to a new job as that moves forward for our young people, and we want to make sure they get into the workforce. But at some point, someone who is supporting their family, we heard for some people that this is coffee money for young kids. We heard from a lot of others that know that this is part of their family's contribution and their income. And so someone who is 18 who is contributing to the family should not be penalized by virtue of their age from somebody who is 21. So at 90 days, we recommend following state guidelines and having that go away. We have recommendations on small business, and this is also, as we struggled with the issue of whether or not to include tips, one of the ways that we thought about making it easier for small businesses, and many of our restaurants fall into that category, is to think about phasing it in longer and to think about how do we extend a period of adjustment so that it is not an initial shock of a wage increase. And so we do recommend an additional implementation period of 1 to 2 years, depending on how the larger implementation period is. I'll say that we're undecided on how to, so I'm not exactly quite sure how to help you think about small or large businesses other than to say the state has a definition that breaks small and large based on revenue. Anyone under $500,000 or $500,000 in revenue is considered a small business. We heard in our listening sessions that that may not be the best approach. We don't have access to revenue data. It is kind of hard to get into payroll data and see what that is. We note that many of our businesses instead offered it should be about number of employees, and frankly, we saw that approach in different jurisdictions. Only 2 really looked at revenue, Arkansas and Arizona and St. Louis. The rest really looked at it in terms of business size was defined by number of employees. As we looked at that, we saw many of our jurisdictions, if they did it at all, they varied all over the map. Seattle had an exemption for small. Their definition of small was 500 employees or less. Emeryville had a definition of 55 employees or less, and Pasadena and perhaps another one in California talked about 25 employees or less. We note, too, that there could be exemptions for micro businesses, and that may be something that you consider. For when we studied the sick and safe time ordinance, we looked at making a special accommodation for our small and micro businesses, and that ended up being at 5 employees or less, are still having to pay still having to offer sick leave, but unpaid. And so that's another way to look at it. We are happy to work with the city attorney's office to continue to discuss other ways in which to look at size of employees, but certainly recommend looking at a number of employees versus a revenue-based source as an approach. And then finally, we come to additional recommendations. These are not things that you asked us for, but I suppose it not stopped us before. So we had some supplemental recommendations as we move forward. One is that we recommend housing enforcement with civil rights departments, and I'm sure that they will thank us for this recommendation later. But they already enforce paid safe and sick and other wage laws, so it seems natural to go ahead and house enforcement there. We also want to say that we strongly urge you to consider including an evaluation, a yearly evaluation. We heard a lot, and again, a lot of this is speculative as to what the impact of our economy be. What will the impact to our restaurant world be? What will the impact on our small businesses be? We hear that. We certainly don't want to say recommendations that we heard it and discounted it. We absolutely hear that. And as a way to address it, we recommend a yearly review of what the impact is on the local economy. We saw many jurisdictions that included a review that looked at sales and tax receipts, that looked at unemployment rates. We saw larger jurisdictions that really looked at the regional economy as a whole, perhaps by industry. So we really strongly encourage council to take a look at or to include in whatever moves forward, if you're considering this or if this policy does indeed pass, that you include an annual evaluation so that we are mindful of whatever unintended consequence we could be causing by inaction of this policy and can adjust as needed in a timely fashion. We also think, and we certainly heard this, again, we heard this in sick leave, we've heard it in a variety of other contexts, that small businesses in particular, not all of whom were opposed to this policy, by the way, there were several small businesses that were really supportive of them, but we also heard enough already. There's a lot of regulation you're imposing on us. Plastic bag bans and sick leave came up as part of them, but that is certainly not the only ones that have come. And so they're like, continue to support what we're doing. And so we've actually got a few of them in a work group that we've been convened at council's direction to talk about small businesses. And so we've been working with them to do some improvements, but they certainly want us to continue to consider how do we support small businesses in an environment where regulation continues to either happen or need to happen, because it can't always be a choice. So with that, finally, I want to say just a thank you, and primarily to the voices that we heard. I don't discount my colleagues who are here, and I really thank the folks that were on the work team that really helped pull this together. But we could not have done this. We could not have put forward recommendations if we had not heard from the many, many, many community voices, businesses and workers alike. We heard a lot about the plight of what it is to live in poverty wages. We heard a lot about what the struggle is to feed a family, to deal with affordable housing. We heard a lot about businesses who are trying to be entrepreneurial and trying to grow in this city and finding this a hardship. One of the things that we heard are there other opportunities to think about startups and entrepreneurs as we move forward? And so maybe those are ideas that we can kind of consider as we support small businesses on perhaps thinking about ways to make life easier for them as they move forward. But we could not have done this without the many, many community voices that we heard, and we thank them for enriching the contents of our study. With that, I will stop speaking and stand for questions.
So thank you very much for that detailed report, and also to the entire team that assisted in putting it together. And I know there are a lot of documents and spreadsheets and collections of the background materials that you reviewed that will be available to the public to also peruse. So I thank you for that. I want to note that we're joined by quite a few people here, and so thank you all for being here. There's, I think, one seat over here if anyone is looking for an additional seat, and maybe one over there. I see that we are joined by many from our Workplace Advisory Committee, including its chair, Chelsea Globitz. So I want to thank all from that group who are joining us today to view the presentation. We've also been joined by Mayor Hodges, Councilmember Palmisano, Council President Johnson. I'll note Councilmember Gordon was here as soon as he could be after a planned commitment. And then Councilmember Andrew Johnson is here due to he has a surgery that planned surgery that he has had. Otherwise, I know that he is paying close attention to this presentation. We are using the speaker management to handle questions, and we do have a lineup of council members who have questions or comments, and we'll start with Councilmember Gordon.
Thank you, Council Vice President. I have about 3 questions right now to start with, I guess. You talked, but before I have asked my questions, as eager as I am, I just want to note my gratitude for the staff report. I have to say that as a policymaker, trying to grapple with this decision, the way that it was written was clear, was readable, was understandable. The way that it was organized was incredibly helpful. The fact that you broke down into the policy decisions, presented various options under each of those decisions, and then had a recommendation is really helpful. So to you and the team, have we already acknowledged the team? who helped write this? Well,
Not by name. but-
I'm at, well, go ahead and give us a wave, but thank you so much. I know some of you aren't waving and you helped with this. Thank you very much, but it was really helpful and it was incredible, and I imagine it was a lot of work. Yeah, but this document is going to make it much easier and maybe less work, hopefully, for the council and others. And I really encourage the general public to take the time to look at it as well. I think it and all the supporting documentation is just wonderful. Now, to a couple questions, or three. You talked a little bit about how there really wasn't much research and it was hard to get research on what impacts this would really have. I'm just wondering if you looked back at all at what has happened historically when minimum wage was raised, because it's not really a new thing. In fact, you've talked about 1984 when we did it in Minnesota, and it maybe would be a new thing for a city to do it, or a region in Minnesota, but the state has done it, and they've done it differently than neighboring states. And it seems to me, just thinking back, it didn't have these rippling negative impacts on our economy. We didn't see enormous job loss. We didn't see businesses closing down and rushing off to the Dakotas or anything. So did you look at any of that research? And am I close in my memory of what actually happened when we've raised ours and others didn't?
Chair Glidden, Councilmember Gordon, we did look at it generally, and not only just what happens here in Minnesota, but we looked at it in other. There are some studies that date back. There's a lot of studies on the issue of minimum wage, as some of our CPIT folks can tell us. But we did look back, and some of the same arguments that we're having today about, oh, this is going to make businesses move and we're going to suffer from it, that we certainly, in looking back, that did not happen. That economies continued, they move forward. The same is true for Minnesota. We don't have that documented, but we certainly included that as part of our review.
Well, great. I just think it's an important point to make, too. I was also curious a little bit about how we define an employee, and can you just remind me how we do it for our safe and sick time? And is there a reason why we couldn't just make it consistent? Because from a policy perspective, it seems like if we have one working definition, it would really be easy for both the city in enforcing something and also for businesses and others to comply to have the same consistency.
Chair Glidden, Councilmember Gordon, if memory serves, and now it seems like that was so long ago, and it was just a year ago, it was a difference, and we chose to go a different route for paid sick, in part to be consistent, to your point, with state law on minimum wage. It's a bit different. Minimum wage is about rewarding people and compensating people for the actual amount worked, whereas sick time is a benefit that accrues over time. So there was an 80-hour limit. You had to have worked in the city for a certain amount of time. You had to have accrued it. You could accrue it within a certain amount of time and then earn the benefit of using it after. So it wasn't quite apples to apples, and so that's why we didn't use that comparator. We decided instead to compare to the state on minimum wage.
Okay. I appreciate that, and I guess it is. Maybe we will need something slightly nuanced and different. My other issue has to do with picking the minimum wage and what it should be. I actually think what would be most beneficial is a living wage of some kind. I noticed in the report you focused on 1980, but in the presentation, at least, we learned that for a single person, it would be $15.25. So I think that would really be key. I'm a little bit curious about if we have any way of predicting what the living wage might be in 2020. Is there a trajectory? Are we making some assumptions? Because rather than chasing after the living wage forever, it would be nice to actually get there and think that we can do that. The assumption being that if people are paid a living wage, then there's going to be less subsidy coming to help support them and provide affordable housing and other benefits and the converse is not to provide any of those, and then they'll be struggling constantly and having an uphill battle just to survive. But did we look at what the living wage might be in 2020?
Chair Glidden, Councilmember Gordon, we did look at living wage. To your last point, I'll say that there are also studies that suggest that the better wages are in a particular jurisdiction, the less reliant on public assistance people are as well, and that there are ways for municipalities and states to save money on public assistance dollars as that moves forward. So to your argument, certainly,
maybe to help
there are
support
studies that do
businesses
that.
and do economic development in other ways because we'd have additional resources.
Absolutely. So as we looked at living wage, we want to make 2 points about that. That we were not, as many other jurisdictions did, trying to reach that. We thought that burden might be a little too much for businesses to bear, and certainly something we can look at. We did look at the inflator we used was from CBO, which I think is a 2.4 inflator over time. I don't have that with me now, but we can certainly get that to you.
Well,
Unless somebody in the group knows, but.
I'm sure Mark knows that. No, okay.
Huh. So the median, I'm told, in 2021, but it's just median, so not the, is expected to be $23.37. In
Okay,
2021.
well, that was a little different than the
Yep.
15.25 for a single person. Today,
Yep.
what would be considered a living wage in Hennepin County in 4 or 5 years or whenever we're projecting it, but, okay. All right, I appreciate all your time. I may have some more questions later.
Thank you. Councilmember Kano.
Thank you, Councilmember Glidden. So first of all, Nuri, thank you so much for this presentation. You were just stellar, and I was tweeting about how good you were. I appreciate all the hard work that staff have put into this, and the faith that we all have as a city to raise the wage and support our working families. Also to all the groups and organizations who have worked so hard over the last 3 to 4 years to ensure that the city continues to do good for our communities. So I have 3 questions, and I'll just kind of lay them out, and you can feel free to address them in whatever order you wish. So one is just generally the timeline that you see for this moving forward. The council, when would we take up this issue as an actual ordinance, and sort of what are you thinking about what will happen next after this presentation? And I want that more for public education purposes so that people here in the room can better understand how we're going to advance this discussion. The second one was about ideas that the staff might have had regarding the ways to capture the impacts of the wage through this a raise in the wage through this annual report or annual sort of tracking system that you mentioned earlier. I'd be curious to hear what some of the preliminary conversations have been from staff members about how do we capture the benefits of this raise in the wage, in addition to all the other things that were mentioned in your bullet point. And then lastly, there was a bullet point about the youth wage, and there was, I believe the number it went up to was 20 years old, and I was curious about why we chose 20 years old versus 18 or 17 or 16. I'm just wondering what the context for that specific recommendation is.
So Councilmember Kano, before we turn to Ms. Rivera Vandermeid, I thought I would step in to answer a little bit of your first question, because really that's a question that is for us, the policymakers. We make that decision to decide on next steps. The staff wouldn't do that. And so I will say, and I can say more about this later because I'm in your question time, but my intention would be that this is now the appropriate time to move more into what I would call the formal process of ordinance consideration, and that I would be moving forward an introduction of an ordinance tomorrow, Friday. I think I would like to hear more discussion from my colleagues, but I think we have a good basis for some of the ordinance framework in the report that's come forward from staff, but it would be good to hear more from our colleagues in this discussion period. And then we would be able to set a schedule for how we would move that forward.
Okay, I just want to say thank you for chiming in. I know that yesterday Nuria and I talked about the timeline, so I thought it would be appropriate for her to address it since she had the floor.
Perfect.
I just want to be clear that I understand the voting and the process lays in our hands, and that is our proper role, but I didn't think it was out of line to ask you to sort of project what you thought the timeline would be. So thanks, Councilmember Glidden.
Thank
and then
you.
the other 2 questions.
Chair Glidden, Councilmember Kano, to the other questions that were on your list, a couple of things. I'll start with the youth wage first because that's frankly pretty straightforward. We chose 20 because that's what state law requires. And so we certainly looked at other jurisdictions, and some of them vary between 15 and 16 and 18. But we thought, again, where we have a state law, that it's pretty straightforward. And even there is a youth training wage under state law that's anyone under 18. But the training wage in particular that goes away after 90 days of employment goes to 20. So we thought that was just the simpler way to approach it. Your other question about ideas that we've had, I'll say that we're at the preliminary stages, and I'm going to speak to a working team member just to see if he has any additional things. But Peter Ebnett has been part of our team. He's been talking to the University of Washington, and we've had some preliminary discussions on the kinds of studies that they have put out. They have now put out 3 studies since implementation on different aspects of it. Frankly, some of the things that we're learning about, and we're just starting this process, is some of their lessons learned and some of the things that they would do differently. So we hope, if this is a recommendation that is forwarded, to give you a little bit more guidance about what that looks like, because we do think that in addition to the traditional things that we've seen in other jurisdictions, which is about gross sales and tax and unemployment rates, that there is kind of a larger question about business retention and how many startups have happened and retained. And some of that is just information that we gather anyway in the economic development world, but we want to be able to see if there are any corollaries. What has been the impact of the voice that we've heard the most in our business community, which has been the restaurant voice? Are we seeing any impact to our restaurant community as that moves forward, or to our non-hospital healthcare sectors as that moves forward? So we would probably, if this were to move forward, have a longer list of comprehensive details of different ways to look at that as well, unless Peter has additional things. Great.
Okay. Council President Johnson.
Thank you, Madam Chair. Again, thank you, staff. Great report. Just so full of information. Everybody that worked on this, thank you. We have such great staff in this city. And thank you to the community that participated in this. I just have a couple things, and I just want to kind of flag them. I was sort of stunned by the percentage of, we hear a lot, and a lot of the discussion has gone around about restaurant and food workers and, hard job. But also a really hard job is this non-hospital healthcare. 28% of the people involved in people of color are employed in the non-hospital healthcare. And I am concerned about, because the costs for those facilities are, or the revenue for those facilities is set by an organization, federal government, state government, that we're not in control of, obviously, that if we look at the challenge that would present for those institutions, the thing that I see is that it will increase the workload on the people that are the caregivers, because in the restaurant industry, you charge your consumer more to make up that difference, and it's discretionary. People can eat in restaurants if they want to. The tightness in this particular industry is of great concern to me. So I just want to put that out there. I certainly support people in this non-hospital healthcare having increased wages, because, like restaurant workers, they have really, really tough jobs. So, but I just think we have to think about what it means to the actual workload for those people. The other thing that I want to put out there, and Nuria, you and I have, Ms. Vandermeid, we have discussed too the kind of yin and yang about, you mentioned that public costs can go down if wages go up, and that is very true. That is very true. That public costs for food stamps and SNAP, WIC. Multiple things, Section 8, all that sort of thing, benefits that people are entitled to based on their income. But that also means that if the public costs go down, people are receiving less money from the public. And so it's sort of like a philosophical thing, I think, where does the onus come from? Does it come from the employer, or does it come from the public? And I don't think that makes a lot of difference to the person whose income is determined by, what their child care subsidy is. If that goes down, that's a cost to them, that if their wages don't go up to in a proportionate amount, they lost money. They lost money. And so I really want to throw that out there. And I know that that's a hard calculation to make, and people qualify for these public programs yearly by going in and showing what their income is. But it is going to make a difference to people if wages go up. So I just want to make that clear. And again, it's a philosophical discussion about who's best to pay, and perhaps it is the person that's employing them rather than the public, but it's a definite thing that's out there. So thank you.
Councilmember Frye.
Thank you, Madam Vice Chair. I know others have thanked staff, but I don't think we can thank enough at this point. Naria, David, Frank, your really entire team have done an extraordinary job. And this has been not just like a recent thing. This has been really over the course of 2 years, from an initial introduction of the concept to implementing a study, to the RFP process, to accepting the study, to a ballot initiative, which was turned down, to immediately moving forward with a staff direction and saying, we are going to do this to uplift workers, and we're going to do so in a reasonable and very thoughtful manner. And I'm really excited to ultimately see this moving forward now. And when you see statistics like 71,000 workers in Minneapolis are going to be impacted by this, it is a proposal that is worth doing. There's not many initiatives that we push forward at the city that impact 71,000 people. When you put up one affordable housing development, maybe it impacts a few hundred. When you allocate $10,000 or $20,000 to a certain nonprofit, certainly that helps as well. But 71,000 people, this is a massive, this is a massive improvement to people's livelihoods and wealth and ability to pay the rent. So it's exciting to see. I had a couple questions. The first was actually regarding Councilmember Gordon's question, and then the answer that followed, and I just didn't understand the answer. So this was regarding the median.
Mhm.
Can you just perhaps reiterate or explain that again? I didn't quite understand.
So we can follow up with Chair Glidden, Councilmember Frem, we can follow up with a layout of what living wage. The question was really about living wage and how do we get to, if we project out into 2021, for example, what does that look like? We noted that Deed had a living wage of 19 something, 80. And so as we looked out, my colleagues gave me a rough estimation that the median, not the average, but the median wage in 2021 is expected to be $23.37. But what we'll do is we'll project it out.
So that's sorry to interrupt. That's the median wage? That's the median
Living wage.
The median living wage for what, though? For what?
It's the three.
It's the median wage for the region.
The median, I don't
Oh.
understand. Why would there be a median living wage for a
Sorry.
region?
I apologize, and
Okay.
I was mistaken. And so that's the median wage for the region, not the living wage. We can project
Okay.
separately the living wage out into 2021, and we will send that to you.
Okay, so the median wage for individuals not salaried by 2021 for the region would be,
23.37.
and that would be for 2 adults and a kid, or that would be for something different?
Yes. No, that would be
That would be for 2 adults
2
and a
adults and a
kid.
kid? Oh, individual. Oh,
Okay,
this goes
so-
to, excuse me, this goes to what we have in the spreadsheet about the median wage. So this is just per person. So the median wage, the median metro wage in Minneapolis right now is $20.76. The median wage in 2023 is expected to be $23.37. We do not have numbers on the living wage, but we will project that out and send it to you.
Okay, so the median wage by 2021
Mhm.
would be $23.
$23.37.
Okay, not a living wage, obviously.
Not a living wage.
And that would be for a single individual.
Yes.
And right now, that living wage,
That median
It's
wage right now, the
$15.25.
comparable is $20.76. The living wage, which is separate, is a different number.
okay. Right now, my understanding is it's $15.20. This is the living wage.
Yes.
For a single adult, no kids, is $15.25. Interestingly,
Exactly.
actually higher than even for one adult. You still $15 ain't a life. Single and a child, $29.87. 2 adults and a kid, $19.80. And okay, I now understand what you're saying with median versus living. Another important concept is as we're looking at a single individual going up to right now it's at $15.25. However many years down the line after implementation, obviously even for a single individual, it's going to be substantially higher. And a statistic that I heard just the other day, actually from Councilmember Bender, is I believe it's 43% of our entire city is living single. They're living alone. And it's a pretty staggering statistic. So when you look at how that would impact, I do believe it would be substantial. And so I'm just proud we're at this place right now. I think this is a great moment when I do think we as a council and as the city can come together. And I think we can pass both an ordinance ultimately that'll uplift workers, as well as accounting for some of the small local business concerns. We could do this thoughtfully, effectively, and ultimately draft a policy that really works.
Councilmember Bender.
Thank you, Madam Chair. Thanks again for all of the work that went into this. I wanted to talk a bit about the youth wage issue. So I think part of the context of this for me is that I have been able to serve on the board of Heading Home Hennepin along with Councilmember Quincy, Mayor Hodges, and a number of the county commissioners. And we put a lot of resources and effort in Minnesota and in the county in Minneapolis to addressing homelessness. But we've made progress on family homelessness. It's down. But we have a lot of factors that are putting more pressure on families, like rising rents and a very low rental vacancy rate. So part of my concern is that I know, and I wasn't able to find the exact statistics, but I know that a lot of our families in shelter are young parents, many of whom may be under the age of 20. And so my overall concern is that we not make assumptions about why people are working and why they need a living wage or one that's approaching more of a living wage. So we should talk more about this overall issue of youth workers and how you landed on this recommendation that's focused specifically on a training wage and more about what that is and how we would define a training wage versus a regular job.
Chair Glenn, Councilmember Bender, and we acknowledge, just as you said, that we don't want to make assumptions on why people work and whether or not they're contributing to their household's income, because we found a lot of that is the case. The reason we ended up going with the training wage versus the state youth wage is in part because of that, because the recognition that perhaps it's youth that primarily are the first entrants into the workforce, but frankly, sometimes it's first-time job seekers, that there is a training period, there is an adjustment period on a new industry, a new job. Maybe people have been out of the workforce and some of them as that moves forward. And again, this is not for adults, but aimed primarily at a targeted range as that moves forward. But we really want to be thoughtful and to be more in parity with the state about thinking about the cost of a business to train young people as they start into the workforce and what that looks like. But again, to limit it in time and space so that it is only 90 days for an adjustment period. And then they too should be able to get $1 for every hour worked or whatever the minimum equivalent is. They should be compensated fairly for the amount of work that they put in.
I think that's helpful. I do want to learn more about this, and part of my concern, I don't want, again, youth who are working for the reasons of needing income for whatever reason are stuck in these training programs or somehow unable to get up to the wage that they need to earn to meet their bills, right? So thank you.
Thank you. So I had a couple of questions here. One is, this is actually a little bit off topic, but I think it's relevant just because of the number of points that were in here about responses you heard from the business community and the fact and concern about impacts and the fact that we did have, I would just characterize a pretty robust conversation in at the council and with the mayor, really starting last year, prior to that, but really last year, where we made some significant investments in how we wanted to address support to the small business community. And so I wanted to just understand a little bit more about what's the status of that work, just because I think it is relevant here, and when we might hear a more full report about what's going to be entailed in that.
Sure, Glenn, thanks for asking. I mean, I think the other big project that we've been working on, some of the very same people on this work team have been working on is in fact the supports to small businesses. It had been authored by Councilmember Andrew Johnson, and we had been waiting for him to return a bit to update and see when we brought a more formal update to council, but I can say that we've advanced this work in a variety of ways. There were 2 staff directions that came out of last year's budget. One was the creation of a small business team, in part funded by an additional position from CPED, another position that had been reallocated from the city coordinator's office, and another position from funding dollars and communications. And so altogether, that team was aimed at figuring out how to kind of really be that customer service end. The topic of navigator was kind of the word that we use there, although we have, in talking to an advisory group, which is also a recommendation that came out of the second portion of those staff directions, it's clear to us that we want to think of it even more broadly than just a navigator. A navigator could be a case manager, but could also be someone who kind of really does more and becomes kind of the advocate, the ombudsman, the touch point to the city. And so we're continuing to think about what that looks like. But in the meantime, we have detailed several people, someone from our I-team, someone that the mayor's office was gracious enough to let us steal and bring into our group, and an additional third position that has been posted as that team continues to move forward. They have, in fact, started working with community and business members. There has been a I-team, the innovation team has been working on a series of projects. Their mayoral challenge this year is immigrant and minority businesses. And as part of that, they too had a community member work group or focus group. And so we've now merged the two, if you will, the advisory group that the small business team had initially started talking to, as well as members of the small business community that had been working with the innovation team to really help us think through what are the needs. And I'll say that some of the early work yields some really exciting learnings. We've done customer journey maps. We started with the restaurant industry, in fact, because we have decided that's where the biggest pain point is for our business communities. We hear more and more that somebody who needs to have a liquor license or open a cafe and has to have a variety of inspectors, that just is a lot to traverse. And so we've done that. From that, we've actually had 2 or 3 industries come forward and say, we'd like to do the same thing for that. So anyway, there's a lot of work going on in that. In terms of the tangible, I'll say that one of the things that work group, to the second staff direction, which is there's a lot of people in the city working on small business issues. There's the Business Made Simple initiative and a group working on that. Certainly CPED, even within its own divisions, has been constantly working on improvement. A lot of people have been working on ELMS, the Enterprise Land Management System, which should yield some improvements in how we automate our systems and how we're able to do transactional stuff in the future, and will lead to a transactional portal at some point in the future. But we heard that we can't wait for that future, that we need something now. And so the innovation team, along with several of CPED staff, have been working on a kind of a bridge portal that we hope to launch in June or July of this year. So we're very close to launching something that really simplifies and puts together resources for the business community in a single place. The other thing, and we have been testing that out with some of our advisory members. The other thing that's really exciting, and we took a page from New York and San Francisco, and the National League of Cities has actually done a big report in 2014 about big ideas for small businesses. And one of the things we saw there was this concept of starter guides. We have a lot of information out there. It is not easy to digest. It certainly is not, certainly if in different languages, for whom English is not the first language. So we're doing these more visual, easy to access starter guides by industry, so that it really speaks to people on how to, if you want to start a business, these are the steps you need to take. If you want to grow your business, these are the steps you need to take. There is another group, and this is also, again, CPED. They have an economic development fellowship, and David, feel free to step in anytime I'm mislabeling something. They are part of an economic development fellowship, and in conjunction with the innovation team have been looking at ways to better bring capital, which is one of the things that we heard of a lot in our listening sessions. How do we get more capital to the people that need them at the right time? It's really important to try to do that. How do we make sure that we are looking at some of the ways in which we have vacant spaces and that people know how to access them? We've got another series of recommendations that should come forward, but we haven't landed on them yet. That certainly is looking at cross-training and increased customer service training, because one of the biggest things we hear is that we hear the immediate no, and nobody's really helping us get to yes. I think it's a misnomer or a misguided thing, because there are a lot of really dedicated staff in the city that actually really are trying to be navigators. As we heard from most recently from business licensing staff, we certainly heard this from people in the development review counter. they already consider themselves navigators. So it's our job to kind of help people be consistent in that message and make sure that we all provide a very welcoming environment. We also been thinking about a use of an appointment or a pre-development reviews for people to make it easier and faster as they come in. Other ideas have come about creating an express lane at the MDR counter so that if you're just paying a permit, you don't have to stand in the back of the line for people for whom transactions are much longer. So there's a series of things that we're trying to do as we move that forward. And we hope to be coming to you in the next month or two with a full set of recommendations as we continue to look at the issue. We know that small businesses and entrepreneur businesses are vital to our community, and so we're trying to do right by them.
Well, and thank you for that. I know I can tell from your answer there is a lot going on. And in part, I ask this because one of your recommendations is staff recommends that the city continue to find ways to support businesses and smaller businesses in particular. And it sounds like there is kind of a full plate of things that we'll have a more concise update on coming up in fairly soon. And I just think it's important to flag that that is coming. I had a couple other questions, so sorry about that. I wanted, and maybe this is a little bit of a comment, in the staff report itself, I thought there was some good background on just a little bit more of the research that says why raise the wage in the first place. It's sort of one of those questions that I think in some ways feels so fundamental. Maybe we sometimes don't talk about it enough. What happens, or what are those benefits in our community? And I know you mentioned the health impact reports, but there's also research that is out there about other impacts that have been studied over time, including reducing employee turnover and increasing the purchasing power. I think that's the biggest one we think about. In terms of what an individual is able to do, and then what is the peace of mind and the health benefits, I think, that then come from that. I don't know if there's anything more you wanted to say on that, but I feel like it was in the full report. It wasn't so much in the summary, and I know you had a lot in the summary, but it's something I feel is a fundamental issue we need to be able to continue talking about. Maybe the thing I will ask you about is this chart that I've seen before that was again in the full report that essentially shows the stagnation of the wage at both the federal level and at the state level, and what that amounts to in terms of your purchasing power. And I wonder maybe if I will ask you to speak a little bit to that, because you made this comment at the beginning about it's challenging to think of who bears the cost in terms of when you are finally taking steps to increase the wage. But I think what we've been seeing is that workers have been bearing this cost for many years, and that's seen in living conditions and these charts that show the stagnation, and then what are people's everyday ability to survive in this world, essentially.
Chair Glidden, thank you. Certainly, we noted a lot of things in the report that we have not had an opportunity to really explore in depth. But we note that the stagnation in wages is one of the reasons that propelled us to come forward. We also see the landscape right now, both on a federal level, on a state level. We don't believe that the minimum wage is going to change anytime soon, and that is another reason that propelled us and compelled us to say that where states can exercise their leadership to change the dynamics, this is a good place to do so. We ourselves, and I don't have the exact number, but I know that we did a calculation just using the inflator of, I believe the CBO is 2.4%. If we did nothing to our minimum wage in 2021, it would be, or 2020, it would be a little bit above $10. And so we would not be making a lot of inroads in what that looks like for our community, and certainly wouldn't be getting near to what a living wage or the purchasing power that brings. We do note that in some of the studies that we saw, we looked a lot at the restaurant industry in particular, although we certainly looked at others, but in some of the studies that modeled and that looked beyond that, they noted that the turnover rate and productivity of their employers increased, that the amount that most people, and again, these are studies, so we haven't quantified that in Minneapolis, but that people who are making more are spending more in communities. and are certainly able to then become consumers in a different way than they would otherwise normally be. We saw that wages are just tremendously stagnant over time, which means that the amount that a dollar buys just continues to decline, and that doing nothing would continue to make the value of that dollar less and less meaningful as we move forward. And yet people are asked to, as Council President Johnson points out, asked to do more and more over time. And so an increase in a commensurate ways really compensates for not just the work they're doing now, but the continued work that our workforce needs to have moving forward. I invite anybody else who wants to add to that equation. Apparently not.
All right. I'm sorry, I've got another one here. So, so this goes, there's been several questions from my colleagues about different measures that you're looking at, the living wage, this medium wage thing, and I just was curious if there were others that you looked at, because there are other ways that I see calculated to look at, like essentially tell the story of how far does this money take you and your ability to make your basic needs. And one that I've seen frequently is the housing cost burden wage, which I think today is somewhere in the $16 or $17 per hour. And so just a question about, did you look at these other items, and why did you pick the ones that you mentioned in the report?
Chair Glidden, I certainly think the cost and the index to affordable housing was something that we looked at a lot, but in our conversations, and one of the things that drove us to living wage was really spurred by community voice. Community voice really mostly spoke not just about housing, but they spoke about childcare, they spoke about transit, they spoke a lot about the existing inequities and the ability to try to live and make a home for their family in Minneapolis. And that spread across a variety of indicators, not just housing. And so we certainly could use the cost of house, the house burden costs as an equation. And if you're interested, we can send that to you. But we chose to do broadly a living wage that really speaks to the variety of issues that we heard by community.
I am not seeing other council members in queue with other questions right now. I did want to reiterate kind of what I did say a little bit already in response to Councilmember Cano's question, is that my intention is that we would be able to start our formal part of the process by introducing an ordinance. And my guess is that several council members may want to have a role in helping with that, and I'd invite you to let the clerk know if you'd like your name to be part of that, and that will essentially kick off our public part of the process. It's been helpful to hear my colleagues' comments, because I guess my intention would be that these recommendations in this report are very good grounding for an ordinance, and will help us, at least in my view, move forward. I think you've helped answer some critical questions, or at least give us some good options. I think you've helped us synthesize a lot of information that exists across many jurisdictions. And it is really, I think, that combination of looking at what happens in our state, looking at other jurisdictions who have taken this step, and there's a growing number of jurisdictions that have done so, as well as taking the impressive amount of feedback that we have received as a city through forums, through surveys, through other means, and being able to synthesize that and add to the information that you gain from research and from doing the surveys and stuff. So I just, again, want to say thank you very much. Councilmember Gordon?
And I don't have a question, I just had a comment. So I don't know if we want to allow Nuria the opportunity to sit down.
Been standing all day.
But I appreciate kind of teeing this up based on the staff recommendations, so I appreciate the Council Vice President for doing this. I'm assuming, and I'm going to suggest that we make sure that we get this introduced at our next council meeting so that we can proceed with drafting the language, and I'd certainly like to participate in being involved in drafting the language. I think the policy parameters kind of defined in the staff report will kind of highlight those areas that we need to fine tune and we need to discuss and narrow in on. And I also think it'll be really important that we are very public about the opportunities for public comment, so that as soon as we have those dates identified, that we get them out there. I think there's, I mean, if we do subject introduction, it'll get referred to a committee, and then they'll set the public hearing dates. But somehow, even if before that, we can identify what they are, or maybe even vote on those at the council meeting, because we certainly have the authority to do that, set a public hearing date, or maybe two. I think we've had some discussions about having two opportunities, so I think that'll be really, really valuable. I also just wanted to push back on one of the comments that I heard that came up about whether or not the difference in somebody surviving comes from their job or from public benefits that they get from the federal or state government, and whether or not that makes any difference to the individual receiving them. I just wanted to say that from my experience, it can make an enormous difference, and the value of thinking and actually earning what you need to survive is very, very different, and gives somebody and their family a different sense of pride, a different sense of value, a different sense of freedom with what they do with their earnings than when those benefits come as some kind of subsidy from the government.
All right, thank you. I'm just double checking if anyone else had requested a comment. I am not seeing anyone. So with that, I'm going to move to receive and file this staff report. All in favor, please say aye. Aye. Opposed? This is a committee of the whole meeting, so I'm going to ask my colleagues if we can have brief reports from your committee so we're aware of the significant action items. First is Community Development and Regulatory Services with Councilmember Goodman.
Thank you, Madam Chair. There are 18 items on the CDRS committee agenda for approval tomorrow. I'll just note the very large number of land sales, including 8 land sales. 9 is a bond refunding issue. 10 is a fairly significant item also. It's the Wellington Condominium Housing Improvement Area, and there's another housing improvement area on this agenda coming forward for staff recommendation to look into that. Item 11 are the regular licenses. 12 is the business license conditions. The rest of the items are partnerships with regard to other units of government that we're either receiving or accepting grants from. With that, I'm happy. Oh, I guess I should point out item 18 is the punishment for certix.
Okay.
I guess that'd be considered notable to some.
Next, thank you very much. Next, we have Health, Environment, and Community Engagement with its chair, Councilmember Gordon.
Thank you, Madam Vice President. The Health, Environment, and Community Engagement Committee is just bringing 3 things forward. One is a ordinance amendment to our amplified sound equipment ordinance, and that went forward without recommendation because there was some confusion in it, and so there'll probably be a substitute with that added language coming forward that the author's been working on with staff. Second item is just a grant acceptance, and the third is probably the most significant item. It's accepting $600,000 related to the consent decree between Northern Metals, the state of Minnesota, and the city of Minneapolis. There was some community input that was taken and a staff direction that was given to the health department to get some community members and stakeholders together to help refine how they spend that money, but we're authorizing them to accept it.
Thank you. Next, we have Public Safety, Civil Rights, and Emergency Management with Councilmember Yang.
Thank you, Madam Vice President. I'm just going to pass just because these are fairly routine, I would say.
Okay. Thank you very much. Next, Transportation and Public Works with Councilmember Wright.
Thank you, Madam Chair. The committee will be forwarding 20 items for council consideration. All items are typical activities of the department, though I will highlight we did a significant conversation around a commercial waste study and looking at different options to meet our goals around diversion and waste reduction. And then item 20 was a passage of resolution declaring the week of May 21st, 2017, the National Public Works Week, and the resolution has many statements I think we would all agree in terms of the services that are provided by that department and all the employees. With that, I'll stand for questions.
Thank you. Next, we have Ways and Means with Councilmember Quincy.
Thank you, Madam Chair. There are 12 items for consideration tomorrow at the council meeting from Ways and Means. We'll have, they're all fairly routine items, so I won't go into any great detail. Gift acceptances, a couple of RFPs, a number of contract amendments. Of note, I would draw people's attention to items 10, 11, and 12 as we're coming up with new non-represented employee salary schedules and politically appointed salary schedules, and the creation of a new position in the Human Resources Department. Those would be the 12 items. If anybody had any questions, I'd be happy to answer them.
Thank you. Next, we have Zoning and Planning with Councilmember Bender.
Thank you, Madam Chair. We have 4 items. One is denying an appeal for a building at 419 Washington Avenue North. Second is a rezoning for the Minnehaha Crossing project. Third is a comprehensive plan amendment regarding Malcolm Yards. And the fourth is a small alley vacation for the item at number 1 project.
All right. And Councilmember Reich.
I'd just like to make a comment. It was on a consent item, but it should be noted the significance of a change to the comprehensive plan. Though I know the intention is very consistent with a lot of city goals, as we move to any sort of actual zoning changes, I think we have to be mindful that that intent is consistent with the result. So just wanted to point that out just because it was very significant, and staff did have very strong language in their disagreement with the approval. So I just wanted to note that for the record. Thank you.
Okay. Thank you very much. Anyone else? I'm not seeing anything. So with that, we have concluded our business and we are adjourned.